Hello, my name is David Trimberger, and I'm answering the Module 3 Discussion 2 question. So in regard to this question, it's asking us to provide a cardiac patient scenario. So starting off with my backstory, I have it written out here so I don't mess it up. So you are dispatched to a 63-year-old male with a chief complaint of shortness of breath and chest pain. The patient's wife is the one who called 911, and she said that your patient was working in the yard when he began to uncontrollably sweat. The wife instructed him to come inside and cool down. The patient still had an uncontrollable sweat when also a sudden shortness of breath and chest pain began to arise, which is why they called 911. This chest pain began to radiate through the jaw and up into the arm. And so upon arrival, you and your partner obtain a initial set of vital signs with a pulse of 130, a respiratory rate of 20 labored, a blood pressure of 140/90, and an SpO2 of 95 on room air. Your patient has cool, clammy skin, and upon suspicion, you run a 12 lead on your patient, and you notice that there is ST elevation and leads 4, 5, and 6, or V4, 5, and 6. At this moment, I am instructed to ask you to pause your video and come up with how you would take care of your patient and put that in the comments below. Okay, so now continuing with my video, the first things that it's asking us to do is give the initial mandatory actions, clinical recognition, and then how you'd recognize and manage the case, and then eventually give a short breakdown of the pathophysiology. So I will start with that now. So the first thing that you need to do is recognize that your patient is having a possible AMI. So the factor that you put them on a 12 lead is one of the main ways that you can recognize that this issue is occurring, because with having elevation and leads for V4, 5, and 6, this is showing that they're having an anterolateral MI. So the way that I would manage this is using the acronym that Mr. Swearingen had, the Mona B GCAF, that whole long thing. So what I would start off doing is I would give kind of like the M in Mona, which is going to stand for morphine. So I would give them some form of pain med to be able to relax the body and allow to reduce heart rate. That way the heart is not having to pump and work as hard. I would administer oxygen to bring up the SpO2, as well as help with the shortness of breath and not have such an oxygen demand on the heart. If their blood pressure allows it, which our patient does, I would give a dose of nitroglycerin to vasodilate the vessels to allow for possible relief from chest pain, as well as to help possibly stop the clot that is formed from causing any further damage. I would also administer a dose of aspirin that will help lower the chances of blood clots continuing, so additional blood clots from forming. And then later I would also administer a beta blocker. This beta blocker is going to help lower the heart rate, as well as help kind of keep the heart rate low continuing in the future, because it's going to stimulate a beta 1 receptor. And then also I would administer some form of heparin that's going to help thin out the blood. That way, whenever this blood clot that is forming, it will allow it to possibly become broken up and help alleviate some of the other further chest pain. Carrying on with the rest of the acronym, the next two additional medications are for in case your patient is allergic to aspirin, as well as it's just helping yet again lower that heart rate. And then once you get to the hospital, the things that they're going to do is they're going to administer a fibrinolytic. This is going to attach itself to the thrombus that is formed, and it's going to help break down the fibrillin fibers that are kind of causing this plaque built up. And then they're also going to do a angioplasty procedure, or possibly give a stent. The angioplasty procedure is going to be a balloon that will inflate, and it'll help break down plaque that is forming, and it's going to allow it to be able to allow blood flow to go throughout the vessel, as well as the stent will help just keep the blood vessel open and at all times. So next I'll be moving into the pathophysiology of an MI. So according to the Lewis Clinical Companion, an AMI is an arteriosclerotic plaque that has been previously stable, ruptures, and it starts releasing substances into the vessel, which stimulates platelet aggregation and thrombus formation, which eventually occludes the vessel. That is my response to module 3 discussion 2 question. Thank you for listening.